Have you ever been stopped in your tracks by a pounding headache or a sore back that won't let you move? Pain can disrupt your life in an instant and make even the simplest tasks feel like climbing a mountain. But here's the good news. The right medication can be your secret weapon to feeling good again. Today, we are diving into two of the most common pain relievers, Diclofenac and Paracetamol, and figuring out which one works best for you. And it is Better Health with Dr. Pain. Before we start, let me tell you a quick story. A friend of mine, Ifwa, who loves to run, started noticing sharp knee pain whenever she started jogging. It got to a point where she couldn't run without wincing in pain. So she faced the choice many of us have faced, Diclofenac or Paracetamol. Which one would get it back on track? Let's find out together. Pain is one of your body's way of telling you that something isn't right. But not all pain is the same, which is why we have different types of pain relievers. Diclofenac and Paracetamol are two of the most trusted ones, but they work in different ways. Diclofenac is a powerful anti-inflammatory agent, and it is a go-to when pain comes with swelling. It's like your body's personal firefighter, calming down the inflammation. It is sold under the brand names Voltfast and Diclofenac. It helps with sprains, arthritis, and injuries. Acetaminophen or paracetamol is sold under the brand name Tylenol. It doesn't fight inflammation, but it works wonders at reducing pain and fever. It goes straight to your brain's pain center and tells your brain, take it easy, we've got this. So let's get back to Ifwa. After her painful runs, she started taking paracetamol, hoping to ease the discomfort, but the relief didn't last. That's because while paracetamol was working on the brain's pain signals, it wasn't addressing the real issue, her inflamed knee joint from all the miles on the road. That's where Diclofenac came in. Once she made the switch, it was like her body could finally breathe again. The swelling started to go down, and within days, Ifwa was back on her feet. The difference? Diclofenac tackled the inflammation head-on, while paracetamol just masked the pain. Here's what Ifwa's story taught what you should keep in mind. If your pain involves inflammation, whether it's from a sprain, arthritis, or an injury, Diclofenac is the better choice. It not only relieves pain, but calms down the swelling, which is the real problem. But if you are dealing with a headache, fever, or general aches without inflammation, paracetamol is the gentler option. Think of it like a comforting hand on your shoulder, calming you down and helping you through the day. It is also less likely to upset your stomach. Both Diclofenac and paracetamol come with their own set of risks, and it's important to know them. Ifwa learned this the hard way when she took Diclofenac on an empty stomach one morning. She soon felt a sharp pain, not in her knee this time, but in her stomach. That's because Diclofenac can irritate the stomach lining, especially if you don't take it with food. Paracetamol, on the other hand, has a quieter but equally important warning. Take too much and your liver might be seriously damaged. Overdosing on acetaminophen, even accidentally, can cause liver damage. So always be careful with the dosage, especially if you are taking other medications which also contain paracetamol. Now here's a question most people ask. Can you take Diclofenac and paracetamol together? The answer is yes, but with caution. Alternating or combining them can sometimes offer powerful relief when dealing with severe pain or fever. However, it's important to follow the recommended dosages and ask your doctor first. For Ifwa, combining them under a doctor's advice helped her get through some of the toughest days of recovery. But slowly but surely, she was back on the trail, pain-free. Whether it's a headache that's slowing you down or an injury that's keeping you off your feet, Diclofenac and acetaminophen are medications you can use to take back control of your life. But remember, each one has its role. Diclofenac for inflammation, paracetamol for pain and fever. So next time you are in pain, think about what your body is telling you and choose the medication that works best for you. Do you want to stay up to date with taking charge of your health and medications? Make sure to subscribe. And if you found Ife's story helpful, hit the like button and subscribe for more medical insights that empower you to take charge of your health. This is Better Health with Dr. Payne. Better health starts here.